Fertility, Colorado. Welcome, everybody. Hi, folks. This is Dr. Magarelli at CNY Colorado, calling you from beautiful Colorado Springs. Alika, hello. Nice to see you. Ulisher, Ovoseek, yes. Auntie 81, hello. Hello, everybody. This is wonderful. Welcome aboard. Hi, Alkiki. Hello. Core Dawkins, what can cause an ectopic pregnancy? Infection in the fallopian tube, that can do it. Endometriosis, that can do it, or just bad luck, unfortunately, or a design issue of the tube itself. Hello, Ovoseek, you just had your egg retrieval in Syracuse. I'm so happy. Miss Griffin, Dr. Fink did my transfer Saturday. He was great. Dr. Fink is fabulous. He is a wonderful addition to my team. We're so happy to have him. He's really great sense of humor, excellent clinician. I am very, very pleased. Hello, Caitlin, Sage, Kirsten, Puffer, welcome from Wisconsin. Hello. Oh, Jamie, it's going to see you tomorrow for your retrieval. Yoo-hoo, 24 eggs, great. Hello, Brittany, good to see you. Hello, kind of an Osborne. Kind of Osborne. Hello from New York. Yasmin, hello. The unplanned journey. Excited for my 7-day results from my Colorado retrieval. It was nice to meet you. Thank you. My pleasure. Happy to be here. No Waste Nutrition, spelled W-A-S-T-E. Interesting. Kayla Thompson, hello. Stephanie Roca, how high does HGH injection help with follicles? Hello, sorry. It is a growth hormone. Growth hormone is a big part of cellular integrity and generation and regeneration. So adding growth hormone, of course, is like regenerating, sort of like the fountain of youth, as it were. Because as you're younger, of course, is when you have the most growth hormone. Why have you all stopped the antiviral, antibacterial, and fungal for transfer, D-1T? That I don't know. I've never used that treatment, so it's hard for me to say. We are supposed to start timed intercourse in 2 weeks, and my husband's semen analysis came back with only 1% normal morphology. Well, Jaylyn, I need more than just your husband, but 1% normal sperm means 99% of all of his sperm are abnormal shape, which reduces the efficacy of intercourse. So, Jaylyn, come back with how old you are, and then I can give you an idea of how that'll influence you. Carrie Fink. Okay, that's great. So Dr. Fink is here. Tomorrow I'm 5 weeks. Thursday I have a blood work. When would be my ultrasound? This is Jamie. Well, as soon as your pregnancy hormone is above 1,000, then or 1,200, we can see the pregnancy. Carol, I'm 42. All my embryos were abnormal. Should I try with my own eggs? Well, that's a choice. We know that as we age, we have more and more abnormal eggs. I'm Dr. Magarelli, but I will tell Dr. Fink you are fabulous. Okay. So really it's age that determines the aneuploidy rate, but just even a 20-year-old has a 50% aneuploid rate or abnormal embryo rate. Hello, I'm 22. My husband is 24. I have recurrent pregnancy loss. Okay. Can you do estrogen priming and testosterone priming at the same time? Yes. I'm looking to get an IUI, but my prolactin came out very high. And I'm looking to, so you want to, it's very easy to fix high prolactin levels. You just take Dostanex or what's called cabergoline, or you could take, there's another one, I'm blanking on it, bromocriptin. These are things that can lower almost immediately your prolactin because elevated prolactins are associated with miscarriages. Yes, Ulishi, you can lower your prolactin levels with medication. Okay to take a second COVID vaccine while also taking IVF meds? Yes, as long as you're not trying to do a fresh transfer, okay? I am 39 years old. I lost my baby. He was 13 weeks. I'm sorry. The baby had Down syndrome and chromosomal abnormality. Should I try naturally again, Well, ethics, of course. I mean, um, unfortunately, we do have very rare times, 1 in 1,000 times, there may be a pregnancy that's chromosomally abnormal that survives. Most of the time, they miscarry or don't implant. So it's still a 1 in 1,000 chance. Well, again, it depends how old you are. Is it Omnitrope benefits, and why did my REI prescribe it in the middle of an IVF cycle? Omnitrope is growth hormone. That's all it is. It's just sort of like the sweetener. Thanks for the kisses. Thank you. Is it recommended to use Prograf or human hormone for implantation a week or two before transfer? Not sure what that is. Okay. Would you have to have your tubes removed before starting IVF? Not at all. The only time Twixy 91 you need to get your tubes removed or blocked is if there are massively overstuffed with fluid called the hydrosalpinx. Is there anything I can do to prevent another chemical, I'm assuming, pregnancy, Brittany? No, there isn't. Can I do progesterone patches instead of injections? Yes. Well, not patches. There's no progesterone patches, but you can do vaginal progesterone. How does prometrium and estradiol help with cyst shrinkage? It stops your brain from producing FSH and LH, which can cause it to grow. I had a hysteroscopy a week ago, and they removed polyps. Could this help me conceive? Absolutely. Well, thanks for answering those questions. My partner had a low sperm count of 1.5 million and FSH is 8.6. Yes. Get him to freeze his sperm now. Freeze your sperm now. In case his numbers start going further down, I would have him do that. So at least he has it stored. And also see a urologist, a reproductive urologist. Known evidence with castor oil to open block tube. No idea, Yulia. With low AMH, is IUI or IVF better? IVF? Oh my God, Adrian, I'm so happy to hear that your pregnancy was successful. Thank you so much for sharing that. Do you recommend proceeding with stimulation with a cyst of 40 millimeters? No. 13 weeks from frozen embryo transfer, and I have had that has not gotten any smaller. I'm not sure what an subchorionic hemorrhage. Anything else I can do? Acupuncture, Crystal. Acupuncture. They're fantastic, especially acupuncture from the American Board of Oriental Reproductive Medicine docs or the Healing Arts docs. Hey, B. Brecken 33, or M. Brecken 33, sorry. Do you feel factor 5 has a direct impact on implantation failure? I actually don't know the answer to that question. I don't know that, but I'll write that down. Factor 5 and implantation failure. Thank you. Doing egg retrieval in the next 2 days in Colorado. Follicles are 18, 19. At about which size should I expect to trigger, tonight or tomorrow? A good diminished ovarian reserve protocol. There's two. You do high dose or low dose. It really is up to you. That's a lot more detail, but you do very high or very low. 3 total transfers, 1 successful but ended in miscarriage, last embryo transfer. Do you recommend doing anything different? It's impossible for me to know what you did, Mary Rogers 88. Franco, fresh transfer and frozen transfer, which one is better? Neither. They're both the same. It just depends on what you're using them for. What are recommended levels of vitamin D? Usually 60 is a nice number. Having an open versus open myomectomy next week, are there any medications to keep away fibroids from my healing time before transfer? They can put you on suppression, which is Lupron. Doing an high, April. Doing an FET this cycle. Baseline ultrasound, my lining was 3 yesterday. For second lining was only 4.5. I was instructed to estradiol. Will my lining improve in time for my third? I hope so. October going in for retrieval and transfer. Anything I should add for the next few weeks? I don't know what you're doing. Is there any risk to doing the Zymot? I don't know if there's a benefit. Can you do an ERA before an egg retrieval? Before an egg retrieval, that's an endometrial receptivity assay. Sure, if you want to. How do I go about starting treatment with a 5-centimeter cyst on the ovary? I only have one ovary. You don't. You kind of wait for it to resolve, or you do surgery. I did Prograf, Lovenox, PIO, Prometheum inserts, and Synthroid. Did you do acupuncture? Did you do Serovital? Did you do growth hormone, Mary Rogers? Do you have endometriosis? Those are the things I would start acupuncture. I would start Serovital, which you can get at Costco. Would Gabri Gons, hello, would you recommend metformin with someone with an AMH of 1? No. I don't tend to recommend the metformin. I recommend low-carb eating, which is better. Is IUI worth it, thinking of skipping straight to IVF? I think IVF is definitely your treatment of choice. When is the best time to do laparoscopy in my cycle? Around days 11. But if you're on birth control pills, you can do it anytime. Miss Puffer, I did, but still ended up with ectopics and a rupture and lost it anyway. Okay. So you must be answering someone else's question. Is it hatching or hatched embryos more successful at transfer? Neither. It has nothing. It has more to do with the chromosomal complement, XOXO Tinzel 6. What is the name you said is Sero, Serovital. Serovital. Hi. Hello. Oh, Michael. I see. Hi, Michael. Do you recommend diluted pregnal injections after a positive beta? Why or why not? You've got the diluted pregnancy hormone. I'm not sure what the benefit after you're pregnant is. Take a breather, Doc. So many questions. Thank you. I think I'll take a breather. Thank you. Slow down, everybody. Oh, gosh. Okay. Thank you. If I ovulate before I get a chance to trigger for my modified natural, can I transfer? No. No. That's the idea behind doing a natural anything is you lose control. Are you okay with Serovital during an embryo transfer? Absolutely. Absolutely. My pleasure, Franco. You transferred 2 embryos to our GC 2 weeks ago. Thank you. First beta was 44. Second was 49 on the 14th day. What are the reasons that HCG would be low rather than negative? Well, because there's implantation, little lemon pie. And give it a chance. It could have been that both stuck and then one didn't stick. So follow it, but not follow it too far. It should double every 2 days. Is it, Sophia, is it better to wait 1 cycle to do another egg retrieval or back-to-back? Back-to-back, I prefer. Why are hatching embryos not good? I hope no one said hatching embryos are not good. They're not better. They're not better. They're simply equivalent. Whether they're hatching or not, they're equivalent, but they're not better or not better. Yulia, my husband had a TISA. I'm 40, he's 49, sperm. Should we do another TISA since my husband has been taking supplements since then? No, I think your sperm are fine. I just finished a donor cycle. Does taking the HCG injection before and after the transfer sound right? A donor cycle well, the HCG injection before and after the transfer. I think those are the booster shots, okay? Should intercourse be avoided before modified FET? Not that I can think of. I can't think of a reason. Do you recommend ICSI for young patients? I think, Sumaya, everybody should get ICSI. Everybody should, yeah, that's what I think. And hatching is okay, but most of us, most of our patients are hatched. Okay, Vanessa's back. Join the CNY Fertility group. Excuse me. Apologize. All righty. What is the difference between natural IVF and IUI? Everything. IUI is just putting sperm in the uterus. That's it. You don't know if it's fertilized. You don't even know if it's near the egg. IVF, you take the eggs out, take the sperm out, put the sperm inside the eggs, grow the embryos, watch the embryos, test the embryos. So there's no comparison. Is there any way to remove fibroids with surgery? Of course. Is it true that there's a 2-month wait list to see you? Hoping not. I think it's 3 months. I'm not sure it's 2 months. But please sign up for cancellations. The moment we call folks, we call them 2 or 3 times. If they don't answer, then we'll fill in the schedule. So please be on the waiting list. Thanks for the kiss. I transferred 2 day 4s. I'm on booster HEG and it's going up, but not quite doubling. That's okay. Just watch it. Ashley, don't watch it too long, but watch it. Hey, Sarah Lee. Hey, Marmy. Hey, Journey. Hi, Imfavlo. Welcome, welcome. I had 1 fresh, 1 frozen. I was successful with my frozen. I now have 8-month-old. Congratulations. I tried back in July and it failed, and I would like to try again next month. Is there anything that you would recommend I do? Melinda, well, acupuncture, Serovital, avoiding alcohol, tobacco, drugs. You bet. Those are the things that I would recommend. I asked for an appointment and it would be on December. So what is this? October, November, December. Yeah. So I hope it can be sooner, Ethics. Do you think less is more sometimes as far as protocols? Yes. Just failed my 3rd FET. What is going wrong on immune phase 3? Well, are these chromosomally normal embryos, Emily? Carissa, do ERA results change depending on if you are day 3 or day 5 embryos? That's a very difficult question because it was designed for day 5 transfers, right? It's going to tell you what's going to happen after 6 days. But with a day 3 embryo, it's going to float in there. I'm not quite sure the applicability. Nicole, I'm likely to transfer next Thursday. When should I try acupuncture? Today, you need to get 8 treatments in. You could do less, but you want to get 8 treatments in. 3 Vastava. Okay. Ashley, they have done 4 betas so far. Tomorrow is my 5th in ultrasound, Ashley. Okay, so make sure they rule out ectopic pregnancy if you're the same lady. Yes, they are tested. This is Emily. This is 3. Okay, so check for endometriosis. Are you doing acupuncture? Are you doing the keto diet or low carb diet? Are the people around you avoiding alcohol, tobacco, drugs, tobacco especially? Marlena, can you transfer the very next cycle after laparoscopy and hysteroscopy, or should you wait a cycle? I would recommend you wait a cycle and heal. After a failure, do you recommend to try again right away? Yes. How does frozen sperm get selected for ICSI? Is there a chance for lab errors? Don't know what that means. We had 1 embryo deteriorated after thought, a problem with chromosomes or lab. No, okay. Yulia, I'm not quite sure what you're thinking. I don't know enough how old you are, what your history is. So I really don't know how to answer that. I did PGT on 2 embryos and they came back abnormal. Should I transfer them anyway? Not in my books. Is there a way to manage my cycle so that my period starts directly after a vacation? So I may have time off from work. Sometimes there is, using birth control pills. Paige, I had an IUI last Tuesday. Today they did blood work. What does that blood work show? How would I know? In other words, they did a pregnancy test. Okay, wait a second. I did it last Tuesday, which is, progesterone. You're looking for progesterone levels. Sorry, didn't understand the question. What do you think about Neupogen for transfer, and when should it be added to a protocol? I don't think about Neupogen. It's not something I particularly utilize. If I have 13 embryos, all graded well, but untested, do you think it's worth it to test them? Yes. Or just transfer them. Those are the 2 options. Hey, doc, do you recommend retrieval before the tubes are removed? Yes. Yes, I do. If anybody has a secret to thickening uterine lining, please tell me. It is so hard. We really don't know. I mean, in intrauterine PRP, maybe once a week for 3 to 4 weeks. Some suggestion it might help. Viagra, some suggestion it might help. Acupuncture, some suggestion. It's really so hard. We don't have a trick to get the lining thick. What do you suggest would help decrease the size of my cyst? Surgery. You can remove a cyst. Birth control pills. If it doesn't resolve in 2 months, then surgery. How long after a isthmus seal repair do you recommend waiting in order to do a transfer? It's usually 4 to 6 weeks. If a lap is done during retrieval, if endo is found, it is removed during it, yes, or is it just exploratory? If a reproductive endocrinologist does a laparoscopy, they're going to remove it. Emily, yes, I did lots of acupuncture and avoided alcohol and tobacco. Did not continue keto diet. 3 failed. I hear you. Yesterday was egg retrieval. I'm 41.9. My protocol was 300 Menopur, 150. I got 4 eggs. Amazing. 3 worm. Oops, they disappeared here. Oh, I lost you. Sorry. If you already removed your tubes due to ectopics, will that have an effect on your retrieval? No. How to avoid ovarian hyperstimulation? A low, slow protocol, protein, and electrolytes and acupuncture. Oh, Brittany, you just had an appointment. My wife is a reproductive acupuncturist. She's an American board certified acupuncturist. She's at East Winds Acupuncture here in Colorado Springs, but there's amazing acupuncturists at the Healing Arts Centers in New York. There's amazing acupuncturists who work with us around the world from the American Board of Oriental Reproductive Medicine. Dr. Credenda and myself created the protocol that the folks will use to help you improve your chances, and we have lots of publications on that fact. In what situation do you recommend mini IVF? When you have only been able to retrieve 1 egg or 2 eggs from a regular IVF cycle, you'll probably get 1 or 2 eggs from a mini. Mini will usually in women with low ovarian reserve. Okay. Can cycles be timed to start cycle directly? I already said that. Yesterday was egg retrieval. Okay, my protocol was 300 of Menopur, 150. I got 4 eggs, 3 mature, 1 mature, didn't fertilize. What protocol should I get? Well, maybe grow 1 additional day on your next protocol. The dose sounded like it was okay. You could increase your Menopur to maybe 450. You could, or you could do a mini. But since you got 4 eggs, you may want to grow an extra day. How does Lupron work exactly? My lining was too thick at baseline, but if I now stay on it until 1 week before transfer, will it prevent lining to thicken? Yes. Carolyn Michelle Miller, it reduces the body's production of FSH, which reduces the body's production of estrogen, which reduces the thickness of the lining. They did an oocyte count. The doctor saw 15 and 15 on both sides. Is it good? I think the name is ovocytes. Follicles. Anyway, yeah, but be careful of ovarian hyperstimulation. I have a phone consultation coming up. Is there anything I need for the consultation? Do I need to fax records? Oh my gosh, yes. Kid XOX, definitely. It's Lena Cruz. What do you suggest for egg quality for 43-year-old IVF is okay? Acupuncture, serovital, growth hormone, avoid alcohol, tobacco, drugs, you and your partner. A good low-carb diet, green crunchy vegetables, lots of fluid, keep yourself hydrated. Tomorrow is my IVF consultation with my local clinic. I'm 39, PCOS. I have previously had 6 failed IUIs. What should I make sure to understand and ask during the visit at a time? Too much to answer, sorry. What made my FSH go over 10 and how can I bring it back down, Melissa? You can't. So Eugenia, go to our website if you're asking questions like that. with my local clinic. I'm not sure what that means, and I'm 39 with PCOS. Yeah, it's just too broad a question. Do you recommend acupuncture weeks leading up to FET, after, or both? Absolutely both, Hannah. Hannah M. Schneider. Emily, would you be open to transferring to PGT tested embryos after 3 failed FET? Yes, I would. What steps do you recommend to take a week or 2 before transfer to ensure implantation? Acupuncture, serovital, keto, low carb, that kind of stuff. All righty. Hello. I have 2 years ago, I just tied my tubes. Do you know if in vitro works for you? Absolutely. It was actually designed for you. 04 Boss Lady 88. Hello. Kara 1513. Is it possible to ovulate during an FET cycle when taking estrogen? Would FET be canceled? Yes, it would be canceled, and yes, it's possible but rare. Everybody, Vanessa Rodriguez is reminding us we have a CNY Fertility Support Group at facebook.com/groups. I can't say the numbers, it's too many of them, but Vanessa, throw that information over on Instagram. Tanjerica, if we have done all the labs and the scope before the consultation, can we get started faster? Maybe a couple of weeks. What's the difference between Lupritide, acetate, and Orilissa? Nothing. They both work to suppress. They're 2 different drugs, of course. One's injection, one's oral. But they work to reduce the body's FSH, LH, etc. Emily, my pleasure. Why is ICSI recommended more often? Because it improves the number of fertilized eggs, and that's the only way to make a baby. You should put somebody in Spanish on live. They actually do. We do. Go look it up. We do have Dr. Verdialis does it Spanish live every week. I don't remember. Go to Facebook or go to our website. They're all listed there. Absolutely. Which diet to follow before IVF? I'm a vegetarian. Well, that is your diet, so I'm not sure what you're asking. Hello, Dr. Magarelli. On stim day 5, I have 83 follicles. What is the expected? Yeah, okay, Lauren, danger, please. Make sure you keep everybody aware. Watch your estrogens. Start 200 grams of protein right now. Start Ultima electrolytes right now. Absolutely get to a board-certified acupuncturist right now and begin prevention. Does the Colorado location do Zymot? Yes. We plan to do transfer in December due to funds. How long should we do keto before transfer? From now until then. Does Provera work to help thin your uterine lining? But what if it doesn't work? Yes, it does work. But what if it doesn't work? Then you may need another injection of progesterone and oil rather than Provera. Heather, at 43, would I be able to do progesterone vaginal inserts, or do I have to do the injections? Your age has nothing to do with it, Heather. If you want the best treatment out there, in terms of the literature, it's progesterone and oil. Nothing beats it. If you want convenience and other things, then you can do the vaginal inserts. But again, it's really up to you how you want to manage your fertility. Yeah, yeah. So I am a doctor talking about protocols, but there's more to you than what you said. You have a lot of big history. So I'm just saying, Yulia, do talk to your doctors, but there's going to be 2 choices. There's going to be a low dose protocol or a high dose. And there's the benefit to a high dose: more eggs, more embryos, possibly more normal embryos. The benefit of a low dose is saving money, fewer eggs, fewer embryos. Yes, Michael, I know the PIO hurts, but so does a lot of things. If I haven't done IVF, what can I do to prepare for it next year? Well, diet, exercise, etc. Okay, Michael, it is worth it. It is worth it. Is a lining of 7.5 at baseline cycle day 4 okay? It's a little thick. It should get thinner. Does sleeping affect fertility? Yes. We don't know how. Is there any chance to increase chances of conceiving a certain gender? No. We can choose a gender for you with IVF with PGTA if your husband makes a boy or a girl. Heather, I've been doing keto, but the scale is not reflecting weight loss. Should I try another diet to get my BMI down? Well, you can. You're doing it for health and wellness, not for weight loss. That's why we recommend a low carb approach. Are you measuring your foods? Are you putting the foods into an app to tell you exactly what you're eating? Are you weighing yourself every day? Those things may be helpful, or you can shift towards a Mediterranean diet. How many acupuncture visits before FET do you recommend? Our protocol, called the CMAP protocol, the Credenda-Magarelli acupuncture protocol, recommends about 8 or 9. According to the WT. According to WT, Rosin, don't know. What is your recommendation on whether to do PGTA testing? Aaron, I don't recommend it or not recommend it. I basically say, look, here's the benefits and here's the cost. Myra, doctor, I plan on doing IVF with you guys, but I'm from California. I'm concerned who will monitor my follicles since my OBG won't do it. Oh my gosh, Myra, on our website, Makeup, we have a list of now hundreds and hundreds of doctors who are happy to help. Shauna, if we are having embryos tested for genetics and gender, should we still have the genetic blood test before? Yes, because one is chromosomes. That's the embryos. The other one is genes. That's the one that's going to tell you if you and your husband or partner sperm provider complement each other for a bad thing. Calibro, because I did not get pregnant when I went with you on the 11th, and there was no explanation if I am healthy and did everything to the letter. In what situation would you recommend 3-day freeze-all if you have less than 4 embryos? Rosin, according to what do we choose high dose or low dose? The cost, Rosin. If you want to spend more money, you do the high dose. If you want to spend less money, you do the low dose. Aaron, can Lupron injection help with egg quality? Not at all, Franco. All right. Where are we at? Is there any specific way to treat adenomyosis before transfer to improve chances? Yes, one way is prolonged Lupron therapy. That's probably your best bet. Again, if you already have frozen embryos. CJMC Guaclin. Is a positive ANA concerning history of endometriosis. I did have a successful FET with you 2 years ago. Oh, fantastic. But recently had this blood work done and not sure if the protocol will change. Well, in all of our protocols, we do add aspirin and Lovenox, which would be the best way of managing the positive ANA. What percentage of frozen embryos thaw without issue? About 99. Yes. Oh, Michaela, thank you so much for saying that. That's very sweet of you. If my TSH jumped from 0.9 to 2.2 in 1 month, I lost it again. Sorry about that. Karen, me and my husband want to have a baby, but I have bands on my tubes. What should be the best thing for us? IVF. Paula, what's your experience on ERA test? Is it worth it? Well, it helps about 25% of folks. So if you're in that unlucky group that don't get pregnant, you might be in the lucky group who are fixed by understanding their ERA. What are the most common side effects from IVF medications? Bloating, hormonal changes, pregnancy. If my TSH jump from that, would Synthroid be beneficial? As long as it's around 2, it's fine. You can, if you ask, to be started on Synthroid, yes. I have fibroids and adenomyosis. I did 2 myomectomies, but still have fibroids. What shall I do? Well, Rosin, you have to have a safe place for the baby to grow. Thanks for the kisses, boss lady. Yeah, get it. You got to have it fixed before you put the embryos in. You do not want to put embryos in. Oh, Jenny, you're so welcome. It's my pleasure. I'm glad you're getting something out of them. We appreciate you guys jumping in. So anyway, I'm Dr. Magarelli. Says it right on the screen there. CNY Fertility, Colorado. Dr. Fink is my partner there. We've got an amazing team of folks who diligently work to make one healthy baby at a time. Caitlin, I started Lupron last night and woke up puking at 4 a.m. for about 4 hours. Should I be concerned or will it pass? You should never puke with Lupron. Stop the Lupron and talk to the team, okay? Does endometriosis come back after removing it? Yes. Can't wait to meet you all in October when I come to Colorado for my retrieval and fresh transfer. You've all been amazing. Sophie, thank you. How do I fix a uterus with fibroids and adenomyosis? Surgery. That's a surgical procedure. When I did not get pregnant, I went with you on the 11th. There was no explanation if I am healthy and did everything to the letter. See, I'm not sure what that question is, Clarabelle. I'm not sure what your question is. Yeah. Do I recommend one embryo transfer or two one embryo transfer? Thank you, Caitlin. Hello, Aaron. Vanessa Rodriguez. Good. I have joined. Indri 28. Remember that picture. How long should I wait after a flu shot to start a retrieval cycle with an immune protocol? I'd say a month. I would say a month. Okay. Some water. Water time. My pleasure. If I have arthritis, will that affect doing IVF? No. I am Atlanta. Which location should I do my transfer? Well, you could do Colorado or New York. Either one is great, as long as that's where your embryos are. With a low AMH and you have two healthy embryos, do you recommend a transfer both at the same time? No, I recommend at separate times. Do you recommend a myomectomy if fibroids are not submucosal or seen through hysteroscopy? I do not. KB baby. KB baby. Okay. Naomi. Do you recommend transferring one or two embryos at 40? If they're chromosomally tested, one. If they're not chromosomally tested, one, with the possibility of two. Do you recommend Lupron or surgery for fibroids and adenomyosis? Yeah, it just depends on the size, location. Rosin. What age do you believe is too risky to try to get pregnant? 75. I ovulated on cycle day 22, got pregnant and miscarried at 3 weeks, 4 days. Could it be egg quality? I don't know how old you are. I don't know. It may be just normal. Yeah, it's a little too broad a question. And the reason I said 74 or 75 is too risky to get pregnant is because people have successfully done it up to age 74. So that's the reasoning. Any recommendations besides acupuncture making healthy choices to improve chance of implantation? Serovital, Serovital, growth hormone, HGH, chance of implantation. HCG wash, reducing the immune system, our immune protocols 2, 3, or 4, and low carb. Would a prenatal loan help improve quality of eggs, or should things be used as well? Read the book. It starts with the egg. Read our website. Read our family building guide. I haven't said that in a while. Guys, if you're on this live, download our family building guide. It's 150 pages now of amazing information. Tells you everything about us. Definitely worth the time. You can buy the family building guide and a lot of other books from Dr. Kiltz on our Amazon, or you can download them for free on our website, I think. What has been your oldest successful patient? 58. BJ pumping, 42, and with low AMH, can I still use my eggs? Sure. When do you start taking Serovital? On the first visit, and then keep going until the kid is 18. And then keep going because then you're older, right? I take Serovital. I mean, it's a growth hormone secretagogue. It makes sense to me. It's patented, so that's what I do. All righty, we're slowing down. Do I have to continue progesterone and oil shots for 8 to 12 weeks after embryo transfer? That's the recommendation, but if it gets onerous, we can switch after about 8 weeks or good heartbeat to vaginal only. All right, everybody's quiet on the Facebook, YouTube side. No more questions there. Looks like Instagram is rushing ahead. You guys getting tired of the questions or? Okay, Jessica, I'm cycle day 3, had baseline today, lining was 10. What will happen if lining doesn't thin out? We'll get your period started again. CoQ10, Naomi, absolutely. Any antioxidant for you and your husband or partner if you're not married, or the sperm provider if you're, however you want to define it. But yes, CoQ10, folic acid for males and females. Vitamin E, zinc for men, arginine for men, Avasitol for most folks. You love the bada bing license plate? Yeah, that's when I visited New York City. Tanjerica, can oral progesterone be taken instead of the shot? It can, but it's not as good. Do you see a difference with egg quality and microlupron flare protocol? No, because that protocol doesn't affect egg quality. Really, protocols, there's some historic thinking that protocols affected egg quality, and there's reasonable hypothesis. But it's not the egg. It's the egg quality is biologic. How much folic acid would you recommend? At least 800 micrograms or 1 milligram at least. You did my egg retrieval. I got 2 frozen embryos untested. I'm 41.9. Do you advise to transfer both or one? I would transfer both if they're untested at 42. What is Avasitol used for? It's used to help regulate blood sugars. Likelihood of good sperm production after 1 year of testosterone injections started in astrazole and Clomid. It's going to take a long time for that to come back. So it'll be at least 3 to 6 months. I have HSG time next week and then Clomid after because of my PCOS, but with 1 tube to direct topic, would you give my rate of success? You got to tell me how old you are, Santos Griselda. Do you add a Zymot or do they not wash the sperm then? I don't use Zymot, so I don't know. Okay. I'm 25, 1 ovary, AMH of 1. What would you consider a good amount of eggs retrieved from this? 4, maybe 6? You're 25 years old. You'll have to go back with the question now. Would you recommend antibiotics before the transfer cycle? Yes, we do that. MFI issues here. Male factor issues. I've had a successful transfer, no sperm in sample now. How likely are we to have success with microtessie? After you check your FSH, if the FSH is normal, you have a 70% or more chance. I'm 25, 1 ovary. I see. How do you diagnose adenomyosis? Usually with an MRI. Sorry, I missed the cyst answer. For sure have cysts. Can I do with IVF with them? Well, you have to be small, those cysts. Those cysts have to be small, Aunt Leah, 81. Modify natural cycle on letrozole. What if my lining and follicles don't grow enough for trigger? Then you don't get a cycle, and you don't get a transfer. Then you stop doing the natural cycle. Do you have an estimate or average amount of eggs for retrieval of a 30-year-old with PCOS and doing mini? It's going to be probably 10 to 14. What is the success rate for IVF for a 23-year-old without genetic testing is about 35 to 40% if there's no other issues. Is 25 millimeter follicle considered over mature? In some cases, but most cases it's fine. Is it normal to have fertile cervical mucus and cramping when taking estrogen during an FET cycle? Yes, but keep yourself more hydrated. I have problems with thick lining. How do I help with that? Well, it depends of the reasoning for it. You may need to have progesterone withdrawal. What's the most aggressive stimulation protocol for IVF? I look at what's the most effective for each person. So there's no such thing as aggressive. Can my egg quality change in 1 year? It goes only down. Egg quality, Evelyn, only goes down as we age and there are fewer eggs. I have problems with thick lining. How do I help with that? We already answered that. I am 34 without Omni and Serovital with 3 months of both. Well, okay. 29-year-old, 2 failed transfer, untested embryo. Should I transfer 1 embryo? This is Paula. Not sure of the question. You can improve your egg quality in a way with diet, as you mentioned, reducing social habits that are destructive, adding growth hormone, adding Serovital, adding keto diet, and acupuncture. I mean, those are ways to improve blood flow. And then blood flow in turn is going to improve the quality of the egg. Oh, how long after transfer until you find out if the IVF was successful? 10 to 14 days. If you bring on another period because lining is thick, how do you time FET? Well, you time it based on that new bleed. So once the lining gets thin, below 5 millimeters, then you'll have a certain amount of days, at least a week to 10 days of estrogen. Then and if everything is fine, your lining is trilamina, above 7 is usually a nice number, 10 is a nice number. Then you start your progesterone, you do that for 6 days, and then you do your transfer. Can I transfer 2 untested embryos if I request, knowing the risk? It has nothing to do with that. Yeah, we don't recommend transferring more than 1. Is there a hope for a woman who's 42 with adenoma? Sure, of course, Rosin. Of course. NYC Dimples joined. Yay, hello. Looks like you guys are wearing out on questions here. So, as you know, we're getting started up in Sarasota, Philadelphia. We're expanding into Philadelphia. We're certainly up in Rochester, Buffalo, Syracuse, Albany. We're still expanding here in Colorado Springs. I mean, we're adding staff, so it's pretty fantastic. Our cycles are certainly increasing dramatically. Our success is good. Marissa, 34-year-old, AMH of 0.6, had done 4 cycles of letrozole, moved to IVF. 3 pregnancies all ended up in early miscarriage. Moved to IVF with chromosomal testing, absolutely. Just got off the phone with scheduling acupuncture. I'm nervous, doesn't sound relaxing. Oh my God, Nicole, we call them needle naps. Are we planning to come to Michigan? Nope, we're planning for Michigan to come to us. Today this week I've had like 3 people from Michigan. Thanks, Michigan. Actually, I lived in East Lansing and was a professor there at Michigan State University for a couple of years. Melissa, I'm 28 weeks pregnant. Wow. Oh my God. Oh my God. I'm so happy to hear that. Okay, let's see. Acupuncture is the best. There you go. Amy, if I had an HSG done more than a year ago, should I get another one? Yes, but you really should get hysteroscopy. Everybody, diagnostic hysteroscopy. Diagnostic, yes. By the way, Tone Jerica, absolutely agree. Texas, we need a place. Minnesota, we need a place. Definitely San Francisco, we need a place. Seattle, we need a place. San Diego, we need a place. Yes, I agree with you. What we provide is really unique and at a price point that allows people to get a baby. April, I have cystic fibrosis, 30 years old, normal FSH, hydrosalping's. Oh my God, yes, you can, April, yes, Perky, absolutely. Please don't worry about that. Las Vegas, nah, we don't want to go to Las Vegas. I'm just kidding. I had the diagnostic hysteroscopy last week. Looking forward to meeting you. Well, I want to meet you too, Amy, so make sure you say hi. 25 years old. Due to my ectopic because of my endometriosis, success rate for pregnancy is still 30 to 40%. New Brunswick, Amber Kelly, absolutely. That's my dear daughter. Hi there, sweetheart. Hello. Yes, we need one in New Brunswick. That's in Canada, if you don't know. That's in Canada. We need a place in Wisconsin. Can't agree with you more, but if it's my daughter, I'd rather go to New Brunswick. Sorry, Melissa. Is there any anesthesia used for embryo transfer? No. Minnesota would be amazing. Yes, I have my in-laws live in Minnesota, so that would be fun to be able to go up there. My dear wife, Diane Credenda from East Winds Acupuncture, is our acupuncturist. Her new doc is Stephanie King, who's an amazing doc, great gal. They're here to serve you. And by the way, any of you folks in global or traveling to Colorado, please schedule your appointments if you know you're going to be here ahead of time. That'll allow you to get those much needed acupuncture treatments prior to the retrievals or prior to the transfers or after the transfers, especially if you're going to do a fresh transfer. Oh my God, get your pre and post and maybe one or two other acupuncture treatments. Ours recommend anywhere between 9 and 11. Rosalia went to Diane twice yesterday. She was the best. Okay. Well, Diane is my wife, Diane Credenda. Ever consider expanding the acupuncture in Colorado Springs to be a full spa like Syracuse? Interesting you say that. We actually think that's coming down the pike. We have so many other issues first, but yeah, we're thinking about bringing on in-house acupuncture in the clinic itself. So stay tuned and call up Dr. Credenda and tell her you want in-house acupuncture. Hope your day is well. Why is retrieval before a hydrosalpinx removal recommended? Because any surgery, Erica, can influence egg access to eggs. So you always want to get your eggs out before you do surgery. Aunt Leah 81, is acupuncture more important for egg retrieval or embryo transfer? Absolutely yes to both. Improves blood flow, reduces miscarriages, improves live birth weight. Uh-oh, we have a fellow New Brunswicker here, Naomi Perry. How cool is that? You're in Canada? Oh, how cool is that? I did not know that. Maybe you know my daughter. Why does follicle size not grow with stim medications, Nani? Well, it could be that you have low ovarian reserve and it's just not responding. Could be you need more medicine. Hi, Doc. Hope your day is well. It is well. Does using a tenaculum during an FET harm the process of implantation? No. For some you need that. It's very rare that you need a tenaculum, but for some, in order to navigate, the tenaculum is just a pointed little kind of like clasp that grasps the cervix to straighten it out, which allows the transfer process to work. What are the chances of a successful cycle with endometriosis? Well, Jess, it has nothing to do with endometriosis in the sense that age, AMH, prior history, and then endometriosis. Is ERA important with a natural cycle? You can't do ERA with a natural cycle. Not that I can think of. No, you can't. Nails by Tutti. Hello. Gaddafi baby. Hello. I'm 23 and my primary doctor says I don't have PCOS and I don't have regular periods. Do you recommend an IUI or IVF? Well, IUI, but I do have a cyst. Well, get rid of the cyst and then do IUI. That's what I would recommend. All right, we're winding down, everybody. The Life of Women of Two Moms. Welcome back. Zandria, thank you. I need one today. Oh, you needed a tenaculum today. Just wanted to clarify. Okay, you're very welcome. Is priming with onimetrope for 5 months harmful to egg quality? No, the opposite. What are the percentages of survival from retrieval to freezing? Too hard an answer. That's too broad. My cycle is between 32 and 49 days. I ovulate every month and have a menstrual cycle. Will meds be able to help? Yes. Yes, absolutely, Erica. We can regulate your cycle. Giselle, by the way, folks, if you don't know, I'm starting my lives are at 4 p.m., not at 4:30 my time. So I go from 4 to 5 Mountain Time. So if you're just joining, we're almost done here. A couple of more minutes. I'm doing a natural cycle next after doing 3 medicated failure. I don't want to do an ERA. Then don't. Hi, doctor. Can my wife take Serovital? Yes. Serovital is a growth hormone secretagogue. It just makes your own body produce growth hormones, keeps you young and healthy. So yeah, don't worry too much about that. Okay. What else do we have here? What other percent? Okay. I have my FET this Friday, doing acupuncture Thursday. Great. Should I do it again the day of FET? Absolutely. And the day after for Tiromo. How do you prevent cysts and adhesion or blood clots? Whoa. That's a hard question. You can't prevent any of them. There's nothing to do to prevent them. You can suppress things, but then you won't have the chance of getting pregnant. I've had 6 IVF starts in approximately 12 months. Is that okay? Yes. You scheduled to do my egg retrieval, but the nurse canceled because of no growth. I have diminished ovarian reserve, AMH is 0, and I had 7 follicles. Should I continue, Nani? Well, have a consult, okay? PYT, just because you have those symptoms does not mean you can not have a baby. In other words, I'm talking physiology. So in other words, if your physiology creates a cyst, we have to time it between the cysts. If you have endometriosis, we have to treat the endometriosis and time it before the endometriosis comes back. If you had adenomyosis, endometritis, all of these things that we do is a timing. So don't be sad that we can't prevent it, but we can manage it. And yes, Nani, at 28 years of age, get a consult. Let's see why you didn't grow anything, and then we go from there. Is there a difference between taking Serovital and Omnitrope? No, both are not growth hormones. One is a growth hormone, the Omnitrope, and that's from outside the body. We put it in. And the Serovital is a vitamin complex that makes your own body produce growth hormones. So they're 2 different mechanisms. Doctor in distress joins. Oh no, I don't want a doctor in distress. So if you're just joining now, I'm about to end the talk. So it goes from 4 to 5 p.m. Mountain Time. Thank you all for joining today. I shout out to all the wonderful people at CNY, the nurse call, the travel team, the prescription team, the financial team, the donor team, the admin people, the clinical people, the wonderful other doctors, the nurses, the MAs, the nurse practitioners, the lab people, the embryologists. It is amazing, the group that is helping you create your families. These guys are dedicated. And thank you for sending love. Thank you for sending kisses. Thank you for being positive. We do survive today with good feedback. Sometimes it's hard. You want to tell us things that you want changed or that you need. Do talk to us. If you feel like we've done a job, please just tell it to the world, as you know, through social media. We're here to help, and we're not perfect. So help us be better. Anyway, next week I'll have time and I will be able to do the last endometriosis talk before I pick another topic. That'll be a third in the series. You guys be well, get pregnant. If you have questions, please, use your portal message system. It's the best way to do it. Make sure you always bring your medications with you. If you're traveling, bring all of your medications, because even though you think you're doing a frozen transfer, you may do a fresh. Bring all your medicines with you. Do not leave them at home. Read all your consents. Do all of your consents. If you don't do the consents before, it delays things. So do your consents. Anyway, I did do a talk on adenomyosis, Razin. It's in the archives. Thanks, folks. You guys have a great day. I'll sign off. This is Dr. Magarelli, CNY Fertility Colorado, along with my illustrious partner here, Dr. Fink, and my whole team, which are wonderful people. Thanks, everybody. Bye.